Good day to everyone. I am here with another coffee break program with you, and today I'm going to discuss with you about MCAS, mast cell activation syndrome, and its relationship with COVID-19. In my last lecture, I taught you about post-COVID syndrome, and I gave you 5 possible theories and suggested theories regarding the etiology of this long COVID syndrome and post-COVID syndrome. Out of those theories, the most credible theory is the MCAS theory, that is mast cell activation theory. So we are going to discuss about that in details today in my lecture. We are going to discuss about mast cell activation syndrome. This is called MCAS. So before we discuss about the mast cell activation syndrome, we have to consider and we have to recall our memories about mast cells. What are the mast cells? Mast cells are all over the body in all the tissues, and they contain a lot of granules, and they have multiple receptors for various things, and especially for IgE immunoglobulin and ACE receptors. Uh, Mast cells, they get activated due to various stimulations, and they release all these granules in their granules contain pores, and they release a lot of inflammatory markers, inflammatory cytokines and inflammatory substances which can trigger up reactions. Even anaphylaxis can happen due to mast cell activation. So where do these mast cells are produced? They are produced in the bone marrow by the myeloid stem cells, myeloid pluripotent stem cells. Out of them, myeloid stem cells produces the granulocyte of mast cell, and these mast cells get into the blood and live in the blood for a short period and go into the tissues, and they get matured in the tissues. Mast cells are almost similar to the basophils, but basophils are matured in the bone marrow and circulating in the blood system. So that is the difference. And these mast cells are responsible for most of the inflammatory allergic reactions in our human body. That is what happens in normal persons. But there are 17% of population of humans in which the mast cells do have an abnormal mutation, and this abnormal mutation causes a lot of problems, and they get triggered off very soon due to very simple stimulus like heat, cold, pressure, allergens, various allergens, and multiple things which are not in normal situation. Mast cells get triggered off. So this abnormal mutation of this 17% of humans causes this mast cell activation syndrome. Among these persons who have these abnormal mutations of these mast cells, there are so many triggering factors which can stimulate this trigger of mast cells and release these granules into the system and cause anaphylaxis and inflammatory reactions, multi-organ involved inflammatory reactions, and even chronic inflammatory reactions. So the COVID-19, long haulers COVID-19 comes under this chronic inflammatory reaction category, and acute severe COVID infection and acute severe COVID syndrome is some sort of acute reaction of this mast cell triggering. For an example, these are few of the triggering factors: heat, cold, pressure. Pressure on the tissue also can cause uh, this trigger, and also various viral infections. We can take COVID as well. You can see that these mast cells do have ACE2 receptors, ACE receptors, so that the COVID virus also can get involved with the mast cells. And but especially the IgE has a major role to trigger off this mast cell activation. And bacterial infections, tissue damage. When the tissue damaged, the mast cell has special receptors to recognize tissue damage, and they get activated. And various allergies, venoms in the sense the snake venoms, bee and wasp venoms, and the venoms of these insects. Those things also can trigger off this mast cell activation. Various allergens means food, pollen and other substances. And stress, psychological factors also contribute. Stress, sleep deprivation, anxiety and many medications, drugs. All these things can cause a triggering of these mast cells, and thereby it can end up with either anaphylaxis or allergic reactions or long-term inflammatory reactions in all the systems. So this is the theory behind long COVID syndrome, post-COVID syndrome and mast cell activation syndrome. Let's see what are the effects of these mast cell activation next. When the abnormally mutated mast cell is activated due to various type of stimuli, it releases various type of inflammatory mediators, among them tryptase, histamine, serotonin, lipid mediators, prostaglandin, leukotrienes, various cytokines including interleukin 4, interleukin 6, interleukin 13 and etc. TNF alpha, proteases and heparin are some of them. So all the inflammatory reactions, acute anaphylaxis to chronic long-standing inflammatory reactions do happen due to these inflammatory mediators. And for an example, if mast cells are activated, if we check the serum tryptase before and after, usually it is 20% more than the baseline serum tryptase levels. And also the other inflammatory markers are released into the system, and by these inflammatory markers again and again more mast cells are produced, and they are activated again and again, and that is how the long COVID syndrome persists. It is due to the results of this viral infection and its viral debris reactivating the abnormally mutated mast cells that the long COVID syndrome happens. Mast cell activation syndrome is about 13% in the normal population, and long COVID syndrome is also about around 20% among the patients who had COVID-19. Now let us see what kind of symptoms that this mast cell activation can trigger off. In mast cell activation syndrome, these are the manifestations of the symptoms that one can get. When we consider the head, fatigue, headache, brain fog, anxiety and sleep problems. In the long COVID syndrome or post-COVID syndrome, the main issue or main symptom is fatigue. And second thing is respiratory problems, and third thing is brain fog. So you can see that mast cell activation syndrome symptoms and post-COVID syndrome symptoms are comparatively similar. For an example, fatigue, headache, brain fog, anxiety, sleep problems. They get insomnia or hypersomnia. And cardiovascular symptoms, they get dizziness, syncope, near syncope, and tachycardia, and POT syndrome, paroxysmal orthostatic tachycardia syndrome. Even in the long COVID syndrome, these are present, post-COVID syndrome. Urinary symptoms, burning sensation and urinary frequency. That also can cause due to mast cell activation syndrome, and even with the post-COVID syndrome, you can see these symptoms. And ENT symptoms, nasal congestion, impaired sense of smell and taste, post-nasal drip. We know even in the long COVID syndrome, these symptoms are identified. And skin manifestations of mast cell activation syndrome: skin heaves, itch, redness, swelling, urticaria. Even in the long COVID syndrome or post-COVID syndrome, you can have these symptoms. And gastrointestinal symptoms: diarrhea, constipation, bloating, flatulence, nausea and vomiting, indigestion and loss of appetite. All these things should consider in this context. So identically, these symptoms are similar, and mast cell activation syndrome is the credible explanation for post-COVID syndrome among the theories which are being suggested so far. And respiratory symptoms of mast cell activation syndrome are prominent: cough, wheeze, breathlessness, chest tightness, chest pain, pulmonary fibrosis due to prolonged inflammatory reactions. So these things are common in post-COVID syndrome as well. So most of the symptoms are similar, and one of the theories is mast cell activation syndrome, which is very credible for post-COVID syndrome. Now we are going to discuss about the treatments. Among various treatment options for mast cell activation syndrome, histamine receptor 1, histamine receptor 2 antagonists, and antihistamines, even aspirin in some occasions but not always, and sodium chromoglycate, which can stabilize the mast cells, and leukotriene inhibitors, ketotifen, vitamin C, vitamin D, even zinc, and dexamethasone, various steroids can be used as treatment options. So this is a very complicated subject, and I made it very simple and very easy for you to understand the post-COVID syndrome in the light of mast cell activation syndrome. Otherwise, we can speak about this mast cell activation syndrome days and days. That is such a vast subject, and there are a lot of chemicals, chemical mediated, more than 1,000 involved in this mast cell triggering, and various type of reactions, immunological reactions and blah blah blah. So in post-COVID syndrome, when the triggering factor or the viral debris or viral infection wane off slowly, the symptoms are also getting better slowly and slowly. So these treatments, which are used for mast cell activation syndrome, can be used for post-COVID syndrome as well. So uh, we have an explanation to the etiology of post-COVID syndrome now. Hope you enjoyed this. I hope you enjoyed the mast cell activation syndrome theory, and hope you have already subscribed for my channel. If you have not subscribed for my channel, please subscribe and encourage me. And I'm going to discuss another topic very soon with you all in my next coffee break program. Thank you so much for listening.